Ladies and gentlemen, on behalf of the Student Scientific Association, with cooperation with Doctoral Students Government of the Medical University of Silesia and Polish Dental Students Association, it is a great honor and a pleasure to greet you all at the closing ceremony of the International Medical Congress of Silesia, SIMC 2025. We thank you very much, authorities of our university, the Vice Rector, Professor Oskar Kowalski, the Dean of the Faculty of the Medical Sciences in Katowice, Professor Tomasz Francuz, the Dean of the Faculty of the Medical Sciences in Zabrze, Dr. Andrzej Tomasik, the Dean of the Faculty of the Health Sciences in Katowice, Professor Anna Brzęk, and the Dean of the Faculty of Pharmaceutical Sciences in Sosnowiec, Professor Robert Wojtyczka. Thank you for honoring us with your presence. We also want to thank all the members of the scientific committees for joining individual sessions and spending time with us. We greet all present active participants of our Congress. It is a great pleasure for us. We received abstracts on a such high scientific level from so many scientific societies, from the universities from Poland and abroad. It's thanks to you, your work and determination, we can be holding the title of one of the biggest conferences in Poland. It is no doubt that we students and doctoral students, with support of our tutors, create science. This year's slogan of our conference was "Shaping Tomorrow's Medicine." We hope that by taking part in our scientific sessions covering such a wide spectrum of topics, all participants have an opportunity to explore new areas of science and expand their medical knowledge. Despite the many challenges we encountered during this year's session of the SIMC, both we, the organizing committee, and you, our dear participants, we have once again shown strength, passion, and commitment to advancing medicine. To summarize the 71st edition of the International Medical Congress of Silesia, I would like to invite Professor Oskar Kowalski to the stage. Professor, the stage is yours.
Thank you very much. And a few words. Is it working? Yes. Thank you very much. I hope it was a few exciting days for you. Good and exciting. That's good. Exciting is good in science too. So congratulations for all of us. It's important step in your future, because we hope you are the future of medicine. So congratulations for all of us, especially of course for the winners. And I hope we meet again next year in the next our Congress in our university. Thank you very much.
Thank you very much for sharing these words with us. We also thank our sponsors and patrons, the honorary auspicious of Marshal of the Silesian Voivodeship Jakub Chełstowski, and the Rector of the Medical University of Silesia, Professor Tomasz Szczepański. Also the media patronage of As Radio and Na Medycynę, and the sponsors of our Congress, Lepolek, Więcej niż Lek, Compendium Medicine, Medycyna Praktyczna, MedWe, Na Medycynę Shop, MedHero Art, Corpus Mind, MedCoach, ProMed, Śląskie Laboratoria Analityczne, Castle and Germany, and MediTrendy. And now I would like to invite on the stage one of our sponsors to say a few words. Please welcome Mr. Bartosz Bober, the president of Na Medycynę.pl, Na Medycynę Shop, MedHero, MedHero Art, and MedWe.
Witam Państwa serdecznie. Przepraszam na wstępie za język polski mojego wystąpienia, ale w takim języku była przygotowana moja prezentacja i dlatego w ten sposób ją przedstawię. Dobrze. Turkusowe zarządzanie. Przygotowałem dla Państwa prezentację na temat turkusowego zarządzania na przykładzie 2 projektów, które obecnie prowadzę. To jest na medycynę oraz MedHero. Plan prezentacji wygląda następująco. Koncepcja, czym jest turkusowe zarządzanie. Porównamy sobie je do ustrojów politycznych. Rozwiniemy o silne, słabe strony oraz słabe strony i podam to na przykładach 2 projektów, które wcześniej zostały przeze mnie wymienione. Całość nie powinna... Polecenia służbowe. Tego wszystkiego nie ma w turkusowym zarządzaniu. W turkusowym zarządzaniu występuje samoregulacja, samostanowienie i poczucie wpływu na kształtowanie otoczenia. Każdy z członków zespołu charakteryzuje się wolnością i ogromną swobodą w podejmowaniu działań i kierowaniu projektem. I to ogromne poczucie wpływu na to, jak ten projekt wygląda, stanowi ogromny napęd tych osób, napęd pozytywny. Brzmi utopijnie, jednak chciałbym tutaj podać przykład, który został podany w książce Frederica Laloux, gdzie autor mówi o ustrojach politycznych i o tym, jak one kształtowały się na przestrzeni czasu. Od ustrojów totalitarnych przez autorytarne i demokrację. To nie jest oczywiste, że w tym momencie mamy demokrację i była ona zawsze. To jej efektywność, jej wpływ na to, jak te organizacje funkcjonują, jak są zrównoważone, spowodował, że w tym momencie są oczywistą dla nas opcją. Ale nie było tak zawsze. Być może również w procesie zarządzania ta ewolucja występuje. Jakie są główne filary takiego zarządzania? Jest to samo zarządzanie, które powoduje, że sami kontrolujemy procesy, które w tym procesie występują. Czyli sami kontrolujemy, jak to wygląda, samo organizujemy sobie czas, sami wyznaczamy sobie cele i przy tak ogromnej świadomości wpływu, jaki mamy na swoją własną pracę, pojawiają nam się pozytywne aspekty i pozytywne napędy w działaniu, nieumotywowane koniecznie finansami. Czyli finanse tutaj stanowią drugorzędowy napęd naszego działania, a pierwszorzędowym jest samospełnienie, czyli drugi filar. W tym wszystkim oczywiście jeszcze ważny wpływ ma cel ewolucyjny, czyli nie dążymy do działań, które są w tym momencie rewolucyjne, które wymagają wykonania w tym momencie pewnego rodzaju rzeczy i doprowadzają do efektu widocznego tu i teraz, tylko u samych podstaw mamy działanie tu i teraz, jednak mamy świadomość, że jest coś więcej w tym wszystkim i to jest nasza główna motywacja. Są oczywiście słabe strony takiego zarządzania i najczęściej jest nim chaos. Chaos jednostek, które w tym funkcjonują. Jednak ten chaos ma bardzo istotny wpływ na kształtowanie innowacyjności i procesów zachodzących. Pośród dyskusji, pośród krytyki wzajemnej w tych projektach, dzięki temu, że ludzie są otwarci, mogą powstawać pomysły, które w żaden sposób nie powstałyby w jednostkach już dobrze zorganizowanych. I czy są w ogóle firmy, czy grupy, które funkcjonują na zasadach właśnie turkusowego zarządzania? Są. Zarówno za granicą, jak i w Polsce. Oczywiście nie dotyczy to całych struktur. Bardzo często jest to jakaś część osób zarządzających, osób decyzyjnych lub twórców projektów, jednak u samych podstaw mówią o tym i deklarują, że są zorganizowane na poziomie turkusowym. I tak jest też zorganizowany portal na medycynę.pl, który tworzę razem z Danielem Gądko. Daniel jest absolwentem studiów lekarskich, skończył studia lekarskie rok temu, jednak kilka lat temu już razem podjęliśmy współpracę na temat współpracę, która utworzyła nam medycynę.pl, portal dla kandydatów na studia medyczne, gdzie u założeń była samoorganizacja siebie i pozytywny napęd w działaniu w postaci właśnie portalu skierowanego dla maturzystów, dla licealistów i dzięki temu utworzyliśmy portal, który obecnie jest odwiedzany przez ponad 200 000 osób rocznie. I to osób nieprzypadkowych, bo są to rzeczywiście maturzyści, są to licealiści zainteresowani tym, jak wyglądają uczelnie, na jakich uczelniach się kształcić, jakie kierunki wybrać. Wszystko od początku było zarządzane turkusowo. Obecnie na tyle portal się rozrósł, że zostaliśmy zauważeni przez prywatne uniwersytety, jak i publiczne, czego przykładem może być Uniwersytet Mikołaja Kopernika w Bydgoszczy, gdzie wspólnie tworzymy specjalną ofertę edukacyjną dla tego uniwersytetu, która wyróżnia się na tle pozostałych. Dobrze. Kolejnym przykładem, gdzie turkusowe zarządzanie w moim przypadku działa, jest projekt MedHero. MedHero to projekt zrzeszający młodych medyków. Młodych medyków, którzy pochodzą z tego uniwersytetu, którzy razem studiują, pracują, uczą się, dyskutują na temat tego, jakie problemy występują w edukacji, w całym systemie i co można wspólnie zmienić własnymi siłami. I mamy już pierwsze efekty naszej pracy. Kilka miesięcy temu premier miał zeszyt do zbierania wywiadu medycznego. Jest to 50 stron teorii dotyczącej tego, jak powinno zbierać się wywiad medyczny. Poczynając od badania fizykalnego, czyli od badania podmiotowego, przechodząc do badania przedmiotowego. I ten zeszyt, z niego już korzysta około 1000 osób. 1000 osób na studiach lekarskich, którzy zdecydowali się ten produkt kupić, którzy korzystają z niego na co dzień przy łóżku pacjenta i są zadowoleni, więc stanowi to naprawdę dla nas pewnego rodzaju wstęp do następnych działań. Kolejnym projektem stworzonym we współpracy z Weroniką Rudecką-Kaczmarzyk są plakaty anatomiczne, które mieli Państwo możliwość zobaczenia przy wejściu do auli. Projekt łączący anatomiczne podejście ze sztuką, która no tutaj Weronika pokazała w najlepszy możliwy sposób. Połączenie sztuki i anatomii. W projektach mamy oczywiście w tym projekcie MedHero kolejne rzeczy, które realizujemy. Są to książki o szyciu chirurgicznym, o USG, które są pisane od studentów dla studentów. I chciałbym Państwa zaprosić do współpracy przy tych projektach. Uważam, że robimy fajne rzeczy. Uważam, że podeszliśmy w bardzo ciekawy sposób do zarządzania i mam nadzieję, że w przyszłości tutaj koledzy i koleżanki będą chcieli wziąć udział w następnych projektach i wspólnie zrealizujemy ciekawe przedsięwzięcia. Z mojej strony to wszystko, także dziękuję Państwu bardzo.
Thank you very much. We truly appreciate your generous support and continued collaboration. We would also like to extend our sincere gratitude to all the institutions and organizations that granted us their scientific patronage. Polskie Towarzystwo Stomatologiczne, Śląska Izba Aptekarska, Polskie Towarzystwo Neurochirurgów, National Research Institute of Oncology in Gliwice, Polish Institute of Evidence-Based Medicine, Polish Association of Surgeons, National Association of Physiotherapists, IFMSA Poland, Polish Chamber of Physiotherapists. We would also like to take a moment to acknowledge our media patrons who helped us to share the spirit of SIMC with a wider audience, and we are proud to be connected with our partner conferences, which share the common mission of supporting student science and medical progress. It is also worth highlighting the record number of workshops held during this year's Congress, an impressive 13 in total. This achievement would not have been possible without the dedication and active involvement of IFMSA Poland Silesia branch. I would like to extend my heartfelt thanks to everyone who contributed to the organization of these workshops. Your hard work truly made a difference. Now I am pleased to invite Anna Siodłak, the main workshop coordinator, to the stage to say a few words.
Ladies and gentlemen, my name is Ania Siodłak, and I have the pleasure of serving as a local officer of medical education at IFMSA Poland, Oddział Śląsk, for the term 2024 to 2025. On behalf of our association, we would like to extend our heartfelt thanks to everyone who contributed to the success of our participation in this year's edition of SIM Conference. We had the great pleasure of organizing 13 practical workshops, which were met with enthusiastic interest from the participants. These included basic and advanced suturing workshops, ECG workshops twice, a neurology workshop, casting workshop, ABC of operating theater, cardiac echocardiology workshop, fast ultrasound and thyroid ultrasound workshop, physical examination workshop, medical sign language workshop, and finally, auscultation workshop. As a student organization affiliated with the university, we bring together over 200 members. Our mission is to support the development of medical students through peer education, creating a safe space for learning new skills, fostering interests, promoting health prevention, and advocating for human rights. Our motto is, by educating others, we grow and learn ourselves. We would like to especially thank the workshop coordinators, whose dedication, professionalism, and passion deserves the highest recognitions. The workshops were prepared by Natalia Adamczuk, Wiktoria Donocik, Kaja Hannes, Gabriela Kolaszyńska, Emilia Jagoda, Maja Majchrzak, Nikoletta Rauer, Magdalena Rzepka, Agnieszka Sawina, and myself. We'd also extend our sincere gratitude to the instructors and experts who shared their knowledge and experience with our participants. Profesor Damian Kawecki, Profesor Beata Morawiec, Dr Agnieszka Machowska-Majchrzak, Dr Piotr Muzyk, Dr Maciej Nowak, Michał Krawiec, Michał Kurnik, Maciej Rapa, and the SONO team. Thanks to your involvement, participants not only gain valuable skills and practical knowledge, but also found inspiration for their continued growth. We also thank all the attendants for the presence, active participation, and for creating a positive and engaging atmosphere during our workshops. Finally, we'd like to express our warmest thanks to the organization committee of 73rd edition of SIMC, especially Ola. Thank you for putting together such an important and impressive scientific event. We wish you, dear colleagues and friends, many more conference, scientific sessions and projects. With respects and gratitude, the IFMSA Oddział Śląsk.
I would like also to express my sincere gratitude to all the entire board of the Student Scientific Association, as well as our wonderful academic assistants whose support, commitment and teamwork were essential to making this Congress such a success. Now I would like to warmly introduce them. Kornelia Korzan, Julia Herbuś, Michał Azierski, Jakub Figler-Rudol, Małgorzata Toroń, Piotr Ziobro, Marta Gędoś, Mateusz Róg, Justyna Kolasa, Martyna Szymańska, Wiktoria Śliwka, Paweł Kurzelowski. And the assistants Barbara Lipka, Julita Klak, Marta Aksamit, Agnieszka Sawina, Aleksandra Sowa, Oskar Woźniak, Julia Szlążek, Beata Nowak, Szymon Smołka, Paweł Rękus, Piotr Słabkowski, Antoni Wołoszyn and Michał Krawiec. We would also like to express our gratitude to Michał Nowak and Dawid Głuch for their IT support. They are with us. Before we proceed with SIMC 2025 session winners, there is one very important prize that we have an honor to award. One of our goals as a student scientific association of the Medical University of Silesia in Katowice is prizing academical teachers who, with their involvement, merited greatly the association with Professor Franciszek Kokot's Award. In particular, by being an authority among students and co-workers, standing out during the realization of actions taken on behalf of the Student Scientific Association, and by those means in outstanding way committing to the development and promotions of Student Scientific Association. This year winner of the Professor Kokot's medal is Dr. Dorota Łyko-Morawska. Please join me on the stage for the prize awarding.
Ja może po polsku, bo ja trochę wzruszona jestem, nie ukrywam. Ja bardzo serdecznie chciałam za tą nagrodę podziękować. Jestem niezwykle wzruszona. Proszę Państwa, ja tu stałam 13 lat temu, dokładnie w tym miejscu, jako zastępca przewodniczącego Towarzystwa Naukowego. I stałam tutaj, tak jak ci nasi wspaniali studenci. Rozdawaliśmy książki, cieszyliśmy się z nagród. Proszę Państwa, teraz odbieram od Państwa nagrodę, za którą bardzo dziękuję, ale również zachęcam do pracy naukowej. Proszę Państwa, Śląski Uniwersytet Medyczny to naprawdę fantastyczne miejsce do pracy i do rozwoju naukowego. I ja bardzo Państwa zachęcam do tego, żebyśmy się spotykali zarówno na studiach, jak i później w przyszłości. Jeszcze raz bardzo, bardzo serdecznie dziękuję.
As Professor Kokot's Award was given, and now it's high time for the part that you all waited for, we will proceed with handing awards to winner of SIMC 2025 scientific session. And we will start with the doctoral session, and please welcome Kornelia Korzan, who will read the winners. Yes, and please welcome the rector and all the deans to help us awarding the students.
We invite to the Professor Brzęk, Professor Francus. Let's begin with the session of experimental medicine. The distinctions goes to use of AGPLC to determine the contents of short-chain fatty acids in selected food products, presented by Michał Nicze. The second place winner is assessment of cfDNA concentration in patients with schizophrenia, presented by Łukasz Czogalik. The second place winner too is unveiling PACS, unveiling the molecular mechanism of PACS2 syndrome through proteomic profiling, presented by Arkadiusz Żbikowski. Let's go to. And the winner of this session is the steroid signature of newborns clinical applications of metabolics profiling in neonatal care, presented by Miłosz Lorek. The next doctoral session is a session of clinical medicine.
Czy to wszyscy już tutaj nagrodzeni? Na razie tu zapraszam. Jesteśmy z nami. Mogę zaprosić Państwa bardzo na środek? Przeczytałam. Tak, proszę. Nie ma trzeciego.
The clinical session, the clinical medicine session of doctorants, certificate of destinations goes to nutritional status of and dietary strategies in tertiary prevention in patients with gastrointestinal cancers, presented by Kamil Mąkosza. The third place winner is the role of mRNA and TRA interactions in the pathogenesis and myocarditis, presented by Maciej Baron.
Czy weszła już na stronę nagroda dla wyróżnienia klinikal dla Mąkoszyk? Wyróżnienie? Ale czy dostał nagrodę, czy już jest na środku? Dobra. Mamy drugie. Bo nie mam wyróżnienia nagrody dla medycyny. Pierwsze i dwa drugie. Z drugiej sesji, z clinical medicine. Pan Kamil Mąkosza zajął pan z panem Mąkosza to jest trzecie miejsce.
The second place winner is non-invasive imaging of individual histological choroid pledged factors, a diagnostic accurate meta-analysis, presented by David Pakizer. The first place winner is pre-hospital hybrid mobile stroke until for acute neuroemergency patients with rural and emotional regions, presented by David Pakizer too.
Basia, zdjęcie. Zrobisz zdjęcie? Dobra. Okay, now we will move to the student session, and we will start from the session of anesthesiology, emergency medicine, and intensive care. And I would like to invite Autoni Wołoszyn, the session coordinator, to the stage to present the results.
So at the beginning, the award of the third place goes to the echoes of the brain, predictive value of optic nerve and CRI ultrasound in patients with intracranial hemorrhage, presented by Julia Lipina. And I also want to invite the whole team contributed in this study to the stage. The winner of the second place is the lactate to albumin ratio and CRP to albumin ratio as predictive elements in critical ill patients, presented by Krzysztof Żerdziński. Tak. And the winner of the session, also Julia Lipina, who presented Sinking Under Surface, Impact of Fluid Intake and Balance on Cardiovascular and Respiratory Status in ICU. So, thank you.
Okay, now we will move to the next session, which is the session of basic science, biotechnology, and biomedical engineering. And please welcome Julia Herbuś, the coordinator of the session.
The winner of second place of the session of Basic Science, Biotechnology and Biomedical Engineering 1 is Aleksandra Polańska for the work entitled Difference in C. difficile and C. perfringens antibiotic sensitivity depending on the medium used. The winner of the second place is Daria Molodestka for the work entitled Bioinformatic Screening of the Lectures Non-Synonymous SNVS in Human GATA1 Gene. And the winner is Clara Ferenc for the work entitled Experimental 3D cell culture model for analysis of ECM produced by fibroblasts from osteogenesis imperfecta. The winner of the second place in session of Basic Science, Biotechnology and Biomedical Engineering 2 is Clara Ferenc for the work entitled Protein Mediation Modulation of Cationic DMA-EMA star polymer cytotoxicity and membrane interactions. The winner of the second place is Weronika Wójtowicz for the work entitled Assessment of the Impact of Hyperbaria and Hyperoxia on the epithelial mesenchymal transition process. And the winner of first place is Karolina Jankowska for the work entitled Role of Splicing Regulators ESRP1 and ESRP2 in epithelial mesenchymal transition in bladder cancer cells.
Okay, now we will move to the session of dentistry, and please welcome the coordinator of the session, Jakub Figler-Rudol.
So in second place, with the work entitled Assessment of Oxidative Stress Markers in Non-Stimulated Saliva from Various Nicotine Delivery Methods, presented by Katarzyna Łęczycka. And since the author's not here, first place entitled Red or Orange Autofluorescence of Selected Candida Strains Exposed to 405 nanometer Laser Light by Julka Maślanka.
Okay. Okay, and we will move to the next session, which is the session of dietetics and nutrition. And please welcome Julia Ślążek, who will read the winners of the session.
The second place for the session of dietetics and nutrition goes to the assessment of consumer exposure to histamine in fermented, non-alcoholic and low-alcohol beverages prepared by Weronika Niedbała. Can we please welcome you to the stage? The first place for the work in dietetics goes to From Forest to Pharmacy, Antioxidant Compounds in Aqueous Extracts from Selected Mushrooms, presented by Julia Lurka. Please may we welcome you on the stage. And the next first place ex aequo goes to Problematic Eating Styles at Different Stages of a Woman's Life, prepared by Karolina Kozik.
Okay, now we are going to the session of gynecology, and please once more welcome the Antoni Wołoszyn to read the award winners.
So the winner of the third place during the session of gynecology and obstetrics is analysis of risk factors, quality of life and POPQ stage, pelvic organ prolapse in women after TLH. The second place goes to a work entitled Where Life Falters, a study of spontaneous abortion and the shadows it casts. And the first place of this session goes to the double responsibility, eating disorders during pregnancy, presented by Aleksandra Leziak.
Okay, now we are going to the internal medicine session, and the coordinator was Jakub Figrer-Rudol, and he will read the awards.
So in third place for the session of internal diseases, the work entitled Is AI as Accurate as Ophthalmologists in Detecting Diabetic? And now the session of invasive cardiology and cardiac surgery. The second place winner goes to the work titled Clinical Characteristics and Mortality in Patients with Cardiogenic Shock, presented by Adriana Błaszczyk. And the first place of the session of cardiology and cardiac surgery is the work entitled Profile of Comorbidity and Surgical Risk in Patients Undergoing TER Procedure by Marta Marks.
Okay, now we will move to the session of neonatology and pediatrics. Once more, Julia Ślążek will read the awards winners.
And the second place ex aequo goes to the work entitled The Way from Heart to the Liver, Hepatic Compilations of Fontan Circulation, presented by Monika Ruszkowska. The second place ex aequo goes to Pediatric Familial Hypercholesterolemia in Silesia. Early findings in 50 patients, prepared by Weronika Curyło. And the first place goes to Clostridioides difficile infection in children treated at Gastroenterology Department retrospective study, presented by Anna Siodłak.
Now we will move to the session of neurology and neurosurgery. And please welcome Jakub Figler-Rudol once more time.
So for the session of neurology and neurosurgery, the third place goes to the work entitled The Role of Vitamin D Supplementation in Alleviating Depressive Symptom in RRMS, prepared by Aleksandra Guzowska. And the second place winner goes to the influence of clinical and radiological parameters on cerebral infarction in patients with aneurysmal SAH, prepared by Dragana Tesic. And the first place in the session of neurology and neurosurgery goes to the work entitled Evaluation of Brain Injury Markers in the Cerebrospinal Fluid of Patients with Smoldering Multiple Sclerosis, presented by Aleksandra Hakało.
Thank you very much. And now we are going to the session of non-invasive cardiology, and once more, Julia Ślążek.
And the third place in the session of non-invasive cardiology goes to the work entitled The Influence of CD Bender on Aortic Valve Calcification Measurement, presented by Weronika Nowicka. The second place winner is Does the duration of atrial fibrillation and its clinical characteristic influence the ECV efficacy, presented by Monika Bączek. And the third place goes to the work entitled Elevated Baseline MicroRNA 92A as a Predictor of Cardiovascular Events in Chronic Coronary Syndrome Patients, presented by Maria Przeździecka.
Thank you very much. We are moving to the session of pharmacy and clinical pharmacology. Please welcome once more Julia Herbuś.
The winner of the second place is Karolina Nizińska for the work entitled Evaluation of the Effect of Combined Use Metformin and Prostilben on Breast and Colon Cancer Cells. And the winner of first place is Viktor Gregorowicz for the work entitled Synthesis and Characterization of Novel Calcium Silicon Phosphatase as Potential Drug Delivery Systems.
Now we are moving to the session of physiotherapy and orthopedics, and please welcome Marta Gędoś.
I cordially invite to the stage representative Krajowa Izba Physiotherapy, who are patrons of the session, physiotherapy and orthopedics session. So, the third place winner for the work entitled Expensive Smartphone Use a Risk Factor for the development of the Quality 1070, present by Miłosz Strugała. The second place winner for the work entitled The Impact of Erupted 3 molars of the occurrence of temporomandibular disorders, present by Maria Benduch. And the first place winner for the work entitled Ultrasound Evaluation of Core Muscle Figure after Local and Global Motor Control Training, present by Oskar Stan.
Thank you very much. And we are moving to the session of psychiatry and sexology. Please welcome Martyna Szymańska.
The second place in the psychiatry and sexuology session is awarded to the paper entitled Alexithymia and its association with alcohol use disorders among resident physicians in Latvia, presented by Anna Aispurete. And the first place in the psychiatry and sexuology session is being awarded to the paper entitled From Silence to Statistics, Uncovering the Hidden Face of Sexual Abuse in Poland, presented by Aleksandra Kępczyńska.
Now we are moving to the session of Public Health and Healthcare 1.
So the second place of the session, Public Health and Healthcare, is titled Artificial Intelligence versus Polish State Exams. Is AI compared enough to become a medical specialist? Presented by Joanna Najbar. And the second place is going to the title Self-Reported Treatment Adherence in Primary Healthcare Patients with Type 2 Diabetes, presented by Gabriela Rembiecha. And the first place is going to title Assessment of Potential Human Exposure to Ticks and Elected Tick-Borne Infection in the areas of Mazovian province. Okay, and now let's move to session of Public Health and Healthcare 2. And the second place is going to title Stigmatization of Patients with Obesity in the Healthcare System Results, a Study on the Discrimination by MEDI, presented by Maja Grzybowska. The second place of this session is going to Dental Health Status of Incarcerated Individuals in Silesia, a 5-year retrospective analysis, presented by Jakub Wierger-Rudol. And the third place of this session is going to title Changes in the Method of Teaching Anatomy and the Importance of Body Donation Program, a Study of Physicians, presented by Konrad Barszczewski.
Thank you very much. And we are moving to the session of Oncology, Nuclear Medicine and Radiotherapy. The second place goes to Clinical Characteristic of Patients with Systemic Mastocytosis, a retrospective single-center analysis by Jakub Kamiński, Sabina Kadłubek. The second place ex aequo goes to Hemophagocytic lymphohistiocytosis in adults, a single-center experience. And the first place goes to the study on the drug repositioning, treatment efficacy in glioblastoma 3D culture models and in vitro co-cultures, prepared by Anna Kozub. Thank you very much. And we are moving to the session of surgery, and please welcome Michał Azierski.
Ladies and gentlemen, let's together cut through the session of surgery. First, we have the certificate of distinction. The certificate will go to the work entitled The Awareness of Risk Factors and Prevention of Economic Class Syndrome Among Medical Students. The work presented by Dominik Sikora. The third place of this session goes to the work entitled Predictive Factors for Complications After Carotid Artery Stenting, a retrospective analysis of 1,132 cases. The work presented by Michał Serafin. The second place goes to the work entitled Predictive Value of Drain Amylase for Clinically Relevant Pancreatic Fistula After Distal Pancreatomy, presented by Juliana Stachaczyk. And the winner of this session is the work entitled Bariatric Surgery as a Method of Treatment for Childhood Obesity, a Clinical Evaluation, presented by Maria Kuczera-Jarosz. Ladies and gentlemen, we are now moving to the session of systematic review and meta-analysis. We do not have the third place, but we have two of the second places. The second place goes to the work entitled Robotic and Conventional Minimally Invasive Pedicle Screw Instrumentation in Thoracocolumbar Fractures. The work presented by Paweł Łajczak. The second place goes to the work entitled Fungal Infections of Cerebrospinal Fluid Shunt in Pediatric Patients, a Systematic Literature Review, presented by Natalia Wyroba. And the winner of this session is the work entitled Pedicle Screw Placement for Adolescent Idiopathic Scoliosis, Bayesian Network Meta-Analysis, presented by Paweł Łajczak. So now let's review the session of systematic review and meta-analysis number 2. The third place goes to the work entitled BDNF and GDNF in Parkinson's disease, Associations with Symptoms, Disease Course and Progression, presented by Patrycja Chudzińska. The second place goes to the work entitled Robotic PCI and Clinical Effectiveness is Newer, Always Better? A Systematic Review and Network Meta-Analysis, presented by Krzysztof Żerdziński. And the winner of this session is the work entitled Riboflavin and Hypersin Medicated APDTT as Alternative Treatments for Candidiasis, a Systematic Review, presented by Jakub Fiedler-Rudol. And ladies and gentlemen, this will be the last session of this conference. So I feel that the emotions are still high. I am a bit nervous. But let's start. The third place of the session titled The Meta-Analysis and the Systematic Review number 3 goes to the work entitled Synergistic Effects of Combined Oral and Topical Antioxidants in Photoaging, a Systematic Review for Clinical, presented by Judith Uguaya. The second place goes to the work entitled Efficacy and Safety of Factor XI Inhibitors for the Prevention of Venous Thromboembolism, a meta-analysis, presented by Aijede Asfin Parisian Sasmana. And the winner of the session is the work entitled The Diagnostic of Minimal Residual Disease in Patients with Hepatocellular Carcinoma, a Systematic Review, presented by Anna Kozub.
Thank you very much. Please stay, the rector and the deans with us, because we wanted to say once more time, thank you very much for your today's presence and helping us with the closing ceremony of SIMC 2025. And we want to give you a bouquet of the flowers. Thank you very much.
Ladies and gentlemen, it's not the end of the ceremony, so please stay with us.
Ale chodźcie wszyscy. Chodźcie. Julka. Wszyscy. Wszyscy, cały dzień. Poproszę zamieszanie małe. Da się zrobić? No zrobię. Z każdego profilu. Dziękujemy. Dziękujemy. Gratulujemy. Jeszcze 300 na koniec.
Thank you all for your contributions to making SIMC 2025 a success. With that, I officially close the 71st International Medical Congress of Silesia. Thank you very much.